81. A nurse can ignore a patient's request to speak with a supervisor. True or false? Answer: false. Rationale: patients have the right to escalate concerns, and nurses should facilitate communication with supervisors, per ANA advocacy standards. 82. The nurse should ensure a patient's bed is in the lowest position to prevent falls. True or false? Answer: true. Rationale: keeping the bed in the lowest position reduces fall risks, promoting patient safety, per the Joint Commission safety standards. 83. A UAP can assist with performing an ECG. True or false? Answer: true. Rationale: performing an ECG is within the UAP scope if trained, with the nurse interpreting results, per NCLEX-PN delegation guidelines. 84. The nurse should report a patient's adverse reaction to a medication to the physician immediately. True or false? Answer: true. Rationale: immediate reporting of adverse reactions allows for timely intervention and prevents harm, per the Joint Commission safety standards. 85. A nurse can delegate the evaluation of a patient's response to therapy to a UAP. True or false? Answer: false. Rationale: evaluating therapy responses requires clinical judgment and is within the RN scope, not the UAP's, per NCLEX-PN delegation guidelines. 86. The nurse should include the speech therapist in the care plan for a patient with dysphagia. True or false? Answer: true. Rationale: speech therapists provide expertise in swallowing management, ensuring safe care for dysphagic patients, per the Joint Commission standards. 87. A nurse can administer a medication without checking the 5 rights. True or false? Answer: false. Rationale: the 5 rights, patient, drug, dose, route, time, are critical to prevent medication errors, per the Joint Commission safety standards. 88. The nurse should advocate for a patient's right to pain management. True or false? Answer: true. Rationale: advocacy includes ensuring patients receive adequate pain management, respecting their rights, per ANA ethical standards. 89. A UAP can assist with applying a non-sterile dressing. True or false? Answer: true. Rationale: applying non-sterile dressings is within the UAP scope if trained, with the nurse ensuring proper technique, per NCLEX-PN delegation guidelines. 90. The nurse should prioritize a patient with a new onset of chest pain over a patient with a scheduled physical therapy session. True or false? Answer: true. Rationale: new onset chest pain may indicate a cardiac emergency, requiring immediate assessment over routine therapy, per ANA prioritization principles. 91. A nurse can delegate the administration of subcutaneous insulin to an LPN. True or false? Answer: true. Rationale: LPNs can administer subcutaneous insulin under RN supervision, per NCLEX-PN scope of practice guidelines. 92. A nurse can share patient information with a media outlet without consent. True or false? Answer: false. Rationale: sharing patient information with the media violates HIPAA and requires patient consent, per federal privacy regulations. 93. The nurse should ensure a patient's wristband is accurate to prevent errors. True or false? Answer: true. Rationale: accurate wristbands ensure correct patient identification, preventing errors in care, per the Joint Commission safety standards. 94. A UAP can assist with performing a sterile catheter irrigation. True or false? Answer: false. Rationale: sterile catheter irrigation requires sterile technique and is outside the UAP scope, reserved for licensed nurses, per NCLEX-PN delegation guidelines. 95. The nurse should report a coworker's violation of patient confidentiality. True or false? Answer: true. Rationale: reporting confidentiality violations protects patient privacy and upholds professional standards, per ANA Code of Ethics. 96. The nurse should prioritize a patient with a blood glucose of 50 mg per deciliter over a patient with a scheduled diagnostic test. True or false? Answer: true. Rationale: hypoglycemia, 50 mg per deciliter, is a medical emergency requiring immediate intervention, prioritizing it over routine tests, per ANA prioritization principles. 97. A nurse can delegate the administration of a PRN pain medication to a UAP. True or false? Answer: False rationale. Administering PRN medications requires clinical judgment and is outside the UAP scope, reserved for licensed nurses, per NCLEX-PN delegation guidelines. 98. The nurse should ensure a patient's discharge instructions are written in their preferred language. True or false? Answer: true. Rationale. Providing discharge instructions in the patient's preferred language ensures comprehension and adherence, per the Joint Commission Patient-Centered Care Standards. 99. A UAP can assist with measuring a patient's weight. True or false? Answer: true. Rationale. Measuring weight is within the UAP scope, with the nurse ensuring accuracy, per NCLEX-PN delegation guidelines. 100. The nurse should advocate for a patient's right to participate in care decisions. True or false? Answer: true. Rationale. Advocacy includes supporting patient autonomy in care decisions, promoting patient-centered care, per ANA ethical standards. 101. The nurse should delegate the application of a cold pack to a UAP for a patient with a sprain. True or false? Answer: true. Rationale. Applying a cold pack is within the UAP scope if trained, with the nurse ensuring proper technique and monitoring, per NCLEX-PN delegation guidelines. 102. A nurse can delegate the assessment of a patient's wound to an LPN. True or false? Answer: false. Rationale. Wound assessment requires clinical judgment and is within the RN scope, though LPNs can report observations, per NCLEX-PN scope of practice guidelines. 103. The nurse should ensure a patient's discharge plan includes follow-up appointments. True or false? Answer: true. Rationale. Including follow-up appointments in the discharge plan promotes continuity of care and prevents readmissions, per the Joint Commission standards. 104. A nurse can ignore a patient's request for spiritual support. True or false? Answer: false. Rationale. Addressing spiritual needs is part of holistic, patient-centered care, and nurses should facilitate support, per ANA ethical standards. 105. The nurse should prioritize a patient with a new onset of shortness of breath over a patient awaiting discharge teaching. True or false? Answer: true. Rationale. Shortness of breath may indicate a life-threatening condition, e.g., pulmonary edema, requiring immediate assessment over routine teaching, per ANA prioritization principles. 106. A UAP can assist with providing oral hygiene to a stable patient. True or false? Answer: true. Rationale. Providing oral hygiene is within the UAP scope for stable patients, with the nurse ensuring safety, per NCLEX-PN delegation guidelines. 107. A nurse can administer a medication without documenting it in the medical record. True or false? Answer: false. Rationale. Documentation of medication administration is required for legal compliance and continuity of care, per the Joint Commission standards. 108. The nurse should report a patient's noncompliance with treatment to the healthcare team. True or false? Answer: true. Rationale. Reporting noncompliance ensures the team can address barriers and adjust the care plan, promoting patient safety, per ANA standards. 109. A UAP can assist with changing a colostomy bag. True or false? Answer: true. Rationale. Changing a colostomy bag is within the UAP scope if trained, with the nurse ensuring proper technique, per NCLEX-PN delegation guidelines. 110. A nurse can delegate the administration of a chemotherapy drug to an LPN. True or false? Answer: false. Rationale. Chemotherapy administration requires specialized training and is typically within the RN scope, not the LPNs, per NCLEX-PN scope of practice guidelines. 111. The nurse should ensure a patient's safety by using bed alarms for those at risk for falls. True or false? Answer: true. Rationale. Bed alarms help prevent falls in high-risk patients, promoting safety, per the Joint Commission safety standards. 112. A nurse can share patient information with a friend who is not involved in the patient's care. True or false? Answer: false. Rationale. Sharing patient information with unauthorized individuals violates HIPAA and patient confidentiality, per federal privacy regulations. 113. The nurse should include the respiratory therapist in the care plan for a patient with COPD. True or false? Answer: True rationale. Respiratory therapists provide expertise in managing respiratory conditions, ensuring comprehensive care per the Joint Commission Interdisciplinary Standards. 114. A UAP can perform a blood pressure check for a patient with stable vital signs. True or false? Answer. True rationale. Blood pressure checks for stable patients are within the UAP scope if trained, with the nurse interpreting results per NCLEX-PN delegation guidelines. 115. The nurse should prioritize a patient with a temperature of 103 degrees Fahrenheit over a patient with a scheduled medication. True or false? Answer. True rationale. A temperature of 103 degrees Fahrenheit indicates a potential infection, requiring immediate assessment over routine medication, per ANA prioritization principles. 116. A nurse can delegate the development of a patient's discharge plan to a UAP. True or false? Answer. False rationale. Developing discharge plans requires clinical judgment and is within the RN scope, not the UAP's, per NCLEX-PN delegation guidelines. 117. The nurse should advocate for a patient's right to receive care in their preferred language. True or false? Answer. True rationale. Providing care in the patient's preferred language ensures comprehension and respects patient rights, per ANA Cultural Competence Standards. 118. A nurse can administer a medication without reviewing the patient's chart for allergies. True or false? Answer. False rationale. Reviewing the chart for allergies is critical to prevent adverse reactions, per the Joint Commission Medication Safety Standards. 119. The nurse should report a patient's pressure ulcer to the wound care team. True or false? Answer. True rationale. Reporting pressure ulcers to the wound care team ensures specialized intervention and prevents worsening, per the Joint Commission Standards. 120. A UAP can assist with applying a splint to a patient's arm. True or false? Answer. True rationale. Applying a splint is within the UAP scope if trained and supervised, with a nurse ensuring proper application per NCLEX-PN delegation guidelines.